Yes, thank you very much. Today, I want to present something to you which we are currently working on. It's something where we really want to prevent unnecessary deaths in the opioid area. We really enjoyed our cooperation here in that area, and we're looking forward to further developing our cooperation. And if you ever come to Germany, to Berlin, please visit us. Well, quick, brief overview. I work for Vista. We've got 245 employees. We've got 15 sites in Berlin. We've got a diverse provision. We've got drug consumption rooms. We also carry out drug checking. And in Berlin, we have about 8,000 substance users who we support. The drug checking project in Berlin, which we started, is something that we do to operate together with Fixpunkt, the GmbH, and the Schwulenberatung, the Gay Advice Office. We do that in partnership. And what concerns us, and where the European Drugs Agency also warns and says we need to be prepared, the opioid market has changed and is changing because the poppy harvests have failed. And up until now, we haven't really had synthetic opioids so much in Germany. And yet, we've already observed more deaths in connection with opioid misuse. So how can we prepare? Well, look at the consequences and effects in the United States. Of course, the access to these products will be different in Europe, but I still think it's naive to think that we won't be affected at all. Of course, as I said, access is different because you get lots of prescription drugs in the USA, and that was the beginning of the opioid market. Here in Europe, the access is usually via the black or illegal market, but the consequences will be very similar. The picture that you see here is really a screenshot from the internet. So synthetic opioids are already available in Germany as well. And this was not a darknet website. No, you don't need a special browser. No, the same way I can find Zalando and other articles and items, I found these items. Here, the producer says they've got 24 items that are being traded, but 24,000 versions are available if you change the molecular structure slightly. We know that in Berlin you can buy legal LSD. There was even advertising. There was advertising in a shop just on the other side of the road. I thought it was a joke at first, but no, you can really buy legal LSD in a shop. And then, of course, you can also order things via the internet. I didn't go through with an order in the end because there's nothing I can do with it. But theoretically, I could have ordered these items. It can be shipped by DHL. There are even reviews that you can see and post. So I could have really bought an awful lot. That wouldn't have been sufficient for me only, but it would have probably been enough for everybody here in the room. So, what does it mean then to be prepared for synthetic opioids? Um, I think, we had the PrEP study, and here some strategies were already identified. The German version is also available. Here we have it's just one strategy really to prepare for the synthetic opioid crisis.
Drug checking is actually feasible in Germany. It's legally doable using paragraph 10b. 10b has made that possible. Till now, it was only possible in Mecklenburg-Vorpommern, a state, in Thuringia, another state. There is also a law, and in Berlin, we have started using a cooperation approach with three Senate governments, so Interior, Health, and um, Justice departments of the Berlin Senate helped us make it happen in Berlin. But now I'm really pleased that we have legal certainty and support. The German federal states need to make this legal amendment happen, but now the paragraph 10a has also been changed, and up till the change of the law last summer, that was the only paragraph that actually consciously forbade drug checking. So this paragraph has been cancelled, it's been scrapped, and it's important to add that drug checking is a full process. Substance analysis and a consultation is embedded as well, be it with a partner organization. So we have integrated this approach with a variety of our partner organizations now. There are a number of target audiences. You can see that we are trying to address consumers who are already consuming in an addiction relationship with a substance. So we're trying to approach a drug scene. We do name that explicitly. But what we then found is that only 1.6% of all the heroin samples we have tested in Berlin actually are from opium users or opiate users. That's not a surprise because the threshold is too high. You have to do a consultation. There's an intake interview. You hand in a sample. It takes 3 to 4 days to find out what the actual drug contains. It's absolute impossible for someone who is physically addicted to wait that long until they receive a result. So we had to take in 40 heroin samples, and the hundredth or thousandth visitor had it had to almost be celebrated because it was such an effort for those affected, and vice versa. It means that the group that is affected also has the highest mortality rate, and that group has no access to drug checking, and this is down to our structures and our slowness. So what we saw in 40 heroin samples from sample size of 2,400, 444 to be exact, we saw that the diamorphin content was very wide. It was sometimes barely anything, up till almost 50%. Most samples had between 20 and 30% content. It kind of shrunk a little bit this year, but you can't fundamentally call this a trend because we have only a few samples, and this is only a glimpse of the reality. You can imagine an opium user is used to heroin that contains 20 to 30% diamorphin, and then you get a sample that has 50%. So you can imagine that can quickly cause a fatality or a near-death experience. In Berlin, almost always it contained paracetamol and or caffeine. That seems to be a typical mixing uh, material. Only where the levels were so high, we didn't see those two padding out products. That means for us, we feel a big pressure to act. We feel a pressure to carry out drug checking for this target audience to make it feasible for them and bearable for them. Most groups in Switzerland, for example, have been doing drug checking for 30 years. We, however, feel like for us it is the newest trend. And when you look at the development, I think that is incredibly slow and late. We haven't got another 30 years time now either. We really need to hit the ground running. We need to implement drug checking. There's a lot of resistance, nevertheless, because there are other analysis procedures that need to be taken on board as well. We can't choose one only and use one that only that takes up to 3 or 4 days. It only gives results in 3 to 4 days. There is a popular argument against drug checking, i.e., it's too expensive. Yes, drug checking costs money, but it will also save human lives. Another thing that makes it difficult with current heroin to carry out the analysis is that half synthetic heroin always consists of 5 to 6 components. That is demanding because throughout the analysis process it's as follows. The analysis machine takes sort of fingerprint of the product and checks against a database, do I already know this? It doesn't split out the substances, but it gives you a full image. And it does that in a very demanding way with heroin, a very conclusive way when testing heroin. And we need to assume that if synthetic opiates are or opioids are on the market, there can be a time where synthetic opioid will be mixed in with heroin. In Canada, for example, there's barely any heroin left. They have pure synthetic heroines or opioids, pardon me, on the market. It can be fatal, but for analysis, it almost makes it easier. The samples and the analyses that are carried out give very precise results, and they need some prep time. The substance must be prepared, then the analysis, the analysis of the volatilized material takes time, up to 60 minutes. Particularly if you have one of these devices, an HPLC in your facility, that can just take too long for an addicted user. So we have looked at infrared analysis. It provides a sort of fingerprint, as I mentioned before, and it only takes a number of seconds. There is a manufacturer we worked with, and they tested it, and this analysis was able to detect diamorphin well, but we can't identify how much very easily, and we can't identify the relationship with the additional products that are mixed in very easily. So the importance is it diamorphin or is it heroin or is it something completely different? And we can also double check whether paracetamol or caffeine has been mixed in. And that might be an indicator. If no caffeine and no paracetamol, the typical mixes are included, that could mean that diamorphin levels are very or particularly high in this sample. The infrared analysis has the benefit that it is quite fast in its analysis and the consumer doesn't have to lose any part of their sample. All of the sample can be consumed. So this is for people who are addicted to heroin, who invest a lot of time and money into this substance and who need it so they don't feel physically unwell. So that is important. Something that is important or particularly good is that a number of these analyses can be used in concerted manner. That is a recommendation from the European monitoring system, as well the European Drug Agency, but the current agency would do it differently. So we want to use this new approach because synthetic opioids, due to the infrared or using the infrared approach, can't be identified. Quick tests for synthetic opioids are currently the most reliable source to document or identify these. Therefore, we suggest combining the methods and suggest a sort of combined offering consisting of fentanyl quick test plus infrared analysis. And in order to ensure these results are correct, we'd like to carry out a conclusive or wide-reaching analysis program where remnants in filters and syringes are used and they are sent in, and that's how we were able to sort of have an observation of the market situation and the trends. Combining those helps us know what's happening on the market. It helps us improve our database. And it also means that the picture is more exact, but it also means that the end user also receives information before they consume the substance. For that, we need the fentanyl quick tests and the infrared analysis as a combined solution. We invented this in Spain. There have already been approaches and attempts and trials, same in New Zealand. The most samples have actually been analyzed in Canada, and that's where we got the idea. The health minister, Minister for Mental Health, Cara Bennett, was traveling around Europe and visited Mr. Lauterbach in Berlin. And we in Berlin also had a visit. They saw drug consumption rooms. And when I double checked what do they use in Canada and why are they even visiting us, why don't we go there and visit them and find out more from them? So on the one hand, the visit was useful for them, but I seem to have spent, it feels like I spent most of the time asking them questions and finding things out from them because Canada has a lot of struggles to manage. They had a lot of time pressure in a number of drug consumption rooms. They did use the infrared drug analysis system, and they have actually identified synthetic opioids. The social workers use it as well, and that was our guidepost. The Canadians have published a lot, and it is worth looking more closely at those things that they're offering in Canada. So what else am I dreaming of? Well, this is something that was already mentioned previously, the fact that things should be or could be combined. I can say that because we have a variety of facilities and drug consumption rooms can reach people we wouldn't reach otherwise. That's because members of staff maybe aren't there enough, but the structures are challenging, but still the drug consumption rooms are helpful. We can figure out what improvements ought to be made, and access to drug consumption rooms should be used to make that possible. I'd love to have a drug consumption rooms that's also a center for action, where substitution can take place, where a consumer can decide, do I go left to the drug consumption room or right to the doctor's and get a substitute and do without heroin today? I'd rather try naloxone. I'd prefer if it were given out free to anyone who comes inside. And I'd love for drug checking to be available in our drug consumption rooms. I'd be delighted if we stayed in contact. Feel free to follow us on social media channels. You can discuss topics with us that way. We have a QR code so that we're more up to date and service oriented. Thank you very much for your attention, but I believe there is some time for questions. Am I right?